Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to your Direct Connection. Coming up, it's nothing to sneeze at. We'll get answers to your questions about sinus problems. That's ahead. First tonight, for many, it is the highlight of the summer, and there are just 7 days left in the annual Maryland State Fair. Joining us live from Timonium is Gary Brewster, who is the chairman of the board of the Maryland State Fair and Agricultural Society. Gary, it's great to see you. How's the weather out there?
Jeff, the weather is perfect. It couldn't be any better, and it looks like it's going to be great weather for the rest of the entire fair.
You know, normally it's 98 degrees on the Midway. Isn't that part of the rules?
Yeah, you're right. It normally is. But this year we lucked out and we have some of the best weather that we've ever had. So I really hope that people can come out and enjoy it because it's very, very comfortable out here.
Well, given the good weather, how many people do you expect there over the course of the 12 days or so?
Yeah, the 11, 12 best days of summer are going to have a little over 500,000 people. Of course, the weekends are the most crowded, but we're open every single day through Monday, Labor Day, September 2nd. So we hope that you'll come out. Things start at noon. Sometimes if you want to see animals, you could come out at 10 in the morning, and they go right through until close at night.
Let me remind our viewers, if you have a question about the fair, you can give us a call. We'll have the number up on the screen. You can also email a question, livequestions@mpt.org. Now, Gary, people think about Ferris wheels, they think about funnel cakes, but the centerpiece of it, I guess, is agriculture, and that's where your personal involvement in this started. I understand there was a really special pony back in 1962, right?
That is correct. At the age of 5 in 1962, I showed my little Shetland pony, Harvey, here in the lead line. And I got a ribbon, but some people say that might have been rigged because at the time, my father was the president of the Maryland State Fair.
Would not rig something as important as that. So your connection here goes back to your father, Senator, U.S. Senator Brewster. The thing has been going on the site there 140 years. So a lot of pressure on current management to keep it going.
Well, you know, Jeff, we have a great team here, and the first fair was at this very location in 1879, but it is our 138th fair because during World War II, in our nation's time of need, the Maryland State Fairgrounds made ourselves available to the United States Army. So it's only our 138th fair, but people come from one end of Maryland to the other. We have thousands of youth, thousands of Maryland children that come here, and this is the pinnacle of their summer. They work hard on a year-round basis to be able to come here and show their animals. And there's approximately 20,000 exhibits here if you include all of the animals and all of the fruit and vegetables and all of the crafts and the quilts, everything. When you include all of that, there are about 20,000 different things for people to see.
And it's a great opportunity. You mentioned the people who come from far and wide, many from an agricultural background, bringing their livestock, but really for anybody who can get to the light rail line, which is a lot of folks who don't live on farms. You can see the cows being milked. You can milk the cows. You can go to the birthing center, and so on. I think there's an auction tonight, right?
Yes, you've got it all just right, Jeff. It's very easy to get here. The Maryland State Fairgrounds in Timonium is very user-friendly. We're right off of Interstate 83. People could take Padonia Road or Timonium Road, but the best way to get here is the light rail. We have a light rail stop right here at the Maryland State Fairgrounds. So you can just hop off the light rail and come right in. And tonight alone, there's bull riding, a rodeo, which is pretty exciting. There's the 4-H and FFA youth auction, where the kids that have worked so hard all year come in and they auction off their animals, and we try to support them. And we recently just had the Miss Maryland Agriculture Contest, where contestants from every county in Maryland, from one end to the other, came and competed, and this year's winner was from Queen Anne's County. So there's a lot going on, and it's all fun.
Over your left shoulder, there is some ride spinning people upside down, sideways, backwards, which brings to mind the question about how all these things are disassembled, moved from one fair to another around the country. And I know they're inspected by the state, but what do you want patrons to know about the safety of the rides and the fair itself?
Well, very good question on both. And this Maryland State Fair is a well-known tradition of safety. The state of Maryland has a ride safety inspection board. They come out ahead of time, multiple times. They check everything as it's being assembled. They check it after it's been assembled. They check it multiple times throughout each day of the fair. In addition to the independent Maryland Safety Ride Inspectors, the Degler's Attractions, based in Florida, that do fairs up and down the East Coast, they also have their own inspectors. Additionally, as far as security in general, everybody is wanded and scanned before they can come in. We have 60 Baltimore County police officers in attendance, Maryland State Police, Maryland Transportation Authority Police, Homeland Security, cameras, drones. This is a very, very well protected fairgrounds, and it's ready for anyone to come here and enjoy it. There's multiple things people can do here to have a lot of fun.
Let's talk about food for a second, but before we go, there's the obvious stuff, the corn dogs and so forth, but you've upgraded a bit too, and there's some Maryland-specific foods.
Yeah, there sure are. One of the most favorite things is the Krabby Patty, and that's a sandwich with a crab cake and also a soft shell crab on it, and boy is that delicious. And then we have the Maryland Food Pavilion with all Maryland products. We have Maryland lamb, Maryland beef, Maryland chicken, Maryland seafood, and we have a raw bar, an oyster bar. When we also have a Chesapeake craft beer and wine garden. So all sorts of Maryland products. It's a great opportunity for Marylanders to come here, try them all out, see what you like, and support our local economy, support our local youth that work so hard to raise the food that all of us eat every day. Maryland Agriculture not only supplies all of our food, but also all of the clothing that we wear. We often don't think of those things, but what the State Fair does is showcases Maryland's #1 industry, agriculture.
Quick word on horse racing. Obviously, you have a track there. You also have off-track betting there, but during the fair itself, you have live racing except for midweek.
That is exactly correct. We had a very successful opening weekend. We had pony races with children riding ponies and races on the real racetrack. This coming weekend, we'll be racing Friday, Saturday, Sunday, and Monday is the last day, Labor Day, and we have thoroughbred racing. We're the only state fair east of the Mississippi that still has live thoroughbred racing, and we're very, very proud of it. We also have, on a year-round basis here, Maryland's #1 OTB, off-track betting, in the grandstand on the second floor with a nice new restaurant that people are really going to enjoy.
Let's get a phone call. Baltimore County, this is Brittany. Brittany, thank you for the call. Go ahead. Brittany, what's your question? Brittany, last call. All right, Gary, before we go, what's the cost for people just to get in there?
Sure. Well, for children 5 and under, it's free. And then there's a reduced rate for seniors and children. For an adult, it's $10. But our first responders and members of the military get in for free because we want to give back to them for all that they do for the state of Maryland. So if you're a first responder or you're a member of the military, please come as our guests to the 2019 Maryland State Fair.
Gary Brewster, chairman of the State Fair, thanks for your time. Hope it's a great next week. We do appreciate it. And we are back with our health segment, answers to your sinus problems, right after this.
Got an unused vehicle going nowhere? Donate it to the one place that can take you any place. Visit mpt.org/vehicles and support the programs you love on MPT.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
I grew up in a small American farming town. Didn't have a lot. I lived with 7 siblings in a single wide trailer. I just felt like, why couldn't life be better for me? I remember to this day, I turned on the TV and saw Les Mis on great performances. The music was so powerful. I believed that I can do that. It truly inspired me. Today I have a full-time career, but I also have a dream, to sing in a prestigious opera company. It takes work, time, dedication. Sharing my love for music with people gives me joy. PBS helped me think anything's possible. Now I really know what I want in life, and that's singing. PBS gave me the confidence to take a chance on myself.
This is a box that showed you a world beyond your own. It was just a box, but the world has changed, and so have we. And now the box can be almost any size or shape. And you decide what you want to explore. Anytime, any place. Break out of the box with PBS.
For tonight's Your Health segment, we are joined by Dr. Andrea Hebert, Assistant Professor of Otorhinolaryngology, that is head and neck surgery at the University of Maryland School of Medicine, and ear, nose, and throat physician at the University of Maryland Medical Center, which I should note is a top 10 ranked specialty. Glad you're with us.
Thank you.
We'll talk about the mysteries of sinuses. Let's start with this. Why do we have them? What do they do?
So they help to actually lighten the head. So they're air-filled cavities, 4 of them, 2 sets of pairs, and they lighten the head. They help to circulate the air, humidify it, filter it, warm it as we breathe it through our nose, and they also help to serve as a protective mechanism for a head-on collision.
Wow. So why do people have so much trouble? So tens of millions of people have sinus problems. Why?
Yeah, so 12 to 15% of the population develops a sinus infection every year. And really the underlying pathophysiology or problem is that inflammation starts in the lining of the sinuses and the lining of the nasal cavity, and it blocks the normal mucus that drains from these sinuses, and that's when you get trouble. That's when you get your infections. They can be acute, lasting less than 4 weeks, or chronic, lasting 3 months or longer.
You happen to bring your sinuses with you in the form of this little model, which may be hard to make out on TV, but I think people, you can point to where it's not one spot where the sinuses are.
Correct. So this is a cross-section of the head, right down the middle. And here we see 2 of the 4 pairs of sinuses. So this is the frontal sinus here, kind of right in front of your forehead, or right in your forehead. And then this is the sphenoid sinus, which is actually kind of in the middle of your head, as you can see here. You also have your maxillary sinuses, which are the cheek sinuses right underneath your cheeks, and the ethmoid sinuses, which I describe as a honeycomb-shaped sinus between your eyes. So you can't really see it on this picture, but
you can see how if you had a problem in there, there's no easy way out, put it that way.
Right. So there are very small drainage pathways for each of these sinuses, and if they get swollen, if the lining becomes inflamed and swollen, things can get kind of stuck in there.
What kind of pain do people get when they have a specific problem in one of those spots?
Yeah, so people will generally describe a specific pain in that location. For example, for the maxillary or the cheek sinuses, they will describe cheek pain or even tooth pain, they'll think it's a tooth infection. For the ethmoid sinuses, they'll describe pain between the eyes or behind the eyes. Frontal, you have a pain right in the front of your head. And then the sphenoid sinus, interestingly, you can present with pain right at the top of your head called a vertex headache, or right in the back of your head called an occipital headache.
Not to pick on quickie clinics, but when somebody shows up and has sort of vague, it sort of hurts. Can they tell? I mean, can a regular internist, from a diagnostic standpoint, are there enough clues to make a decent diagnosis?
Yeah, so most of the time we have to discern from a constellation of symptoms. So it's not only facial pain and pressure, but it's also decreased ability to breathe through your nose, discolored drainage from your nose, and then change in your sense of smell. So really we use those four constellation of symptoms to determine whether or not someone has a sinus infection. And based on that, that's where and then the duration of symptoms as well will determine how we treat the patient. We don't usually recommend for any other imaging or anything like that at that point in time when they present with an acute symptom.
Let me remind our viewers, if you have a question about sinus issues, now is your chance. Give us a call. We'll have the phone number up on the screen. You can also email us, livequestions@mpt.org. And let's start with a question from a viewer. Can reoccurring sinus infections cause damage to other nearby areas, the eardrums, the throat, the brain?
So that's a great question. So acute sinus infections can cause complications. They can spread to the brain. They can spread to the eye. So they can be pretty detrimental. It's not necessarily the recurrence of them, but it's just if you have one very bad, severe one. So yes, acute sinus infections can be very detrimental. And typically we recommend if you've had an infection for over 10 days, or if you've had it at 5 days, if you have worsening in your symptoms, you really should get checked out by a physician.
Okay, what does the physician do? Well, before that, self-care.
Yeah.
I would probably load up on decongestants, Sudafed, maybe a saline spray. Is that right?
Exactly. So from, when you first start noticing that you're coming down with something, you want to start with the symptomatic management. So decongestants, both topical and oral. The saline rinses. So I usually really tell my patients that, it can't hurt to use a saline rinse, particularly if you're using one with distilled or boiled water. That helps to kind of flush the mucus out, flush anything out, and help to clean things out. And then symptomatic treatment in terms of pain management also can help at that point. You really, at the time when if you notice improvement and then worsening after about 5 days or so, or if it's been about 10 days, that's when you really want to seek medical care.
And what's the first thing medical care is going to do?
So they're going to most likely put you on an antibiotic based on, at that point in time, based on your symptoms and based on what the most common bacteria are that cause sinus infections.
Not necessarily based on a culture, just a guess or a broad spectrum?
Correct. Based on what the most common bacteria are that cause sinus infections.
Does that typically resolve it? And how, over what period of time?
Yeah, so that typically does resolve it. It can take, a few weeks or so to feel kind of back to your baseline. But, it's going to be about a 10 to 14 day course of medicine, depending on what the antibiotic is. Typically, if you go to an internist, they're not going to necessarily culture your nose because the sensitivity of that culture is pretty poor. But if you go to an ear, nose, and throat doctor, a lot of times we will take a look in the nose with a camera, and we will, if we see pus, we will culture it to get you culture-directed antibiotics.
I was going to ask how clogged up somebody can get, but let me ask this: is it seasonal? Do you see more problems with colds in the winter? Hay fever in the springtime? What do you see?
I think maybe I'm a little bit biased just because I'm an ear, nose, and throat doctor, and a lot of people come to me specifically for that. So I see patients with sinus infections all year round. But Yes, definitely in the wintertime when people have an increased incidence of upper respiratory tract infections. In the fall and the spring with seasonal allergies, that definitely increases the prevalence of patients with sinus infection.
Let's take a phone call. This is from Cecil County. Helene on the line. Thank you for the call. Go ahead.
Yes, about almost 3 weeks ago, only 3 weeks Saturday, I fell on my face really bad. I got a CT scan. I had a concussion, but I didn't have any damage. But my whole face, my cheek was swollen, really big, because it hit the eyebrow and the face. And I'm still having sinus problems, the top of my head and the back of my head.
My goodness. Well, we'll get you an answer. Best of luck, Helene. Thank you for the phone call. Common?
Yeah, so typically, after facial trauma, you can definitely have a lot of facial pain. If she had any nosebleeds associated with this, there can be some blood that remained in the sinus cavity, particularly in the cheek sinus, the maxillary sinus. And that can be a breeding ground for bacteria and for infection. So, I would definitely recommend that she seek medical care. Saline rinses, again, definitely to help clean out that nose and see if there's anything else that needs to be done, any further workup in terms of her trauma.
Let's talk about neti pots. I think that's what they're called.
Yeah.
And it looks like a magic lantern. And you see people somehow pour water up one side of the nose and it comes out the other side. This doesn't sound like fun, but it must be helpful.
Yes, I'm really a big neti pot enthusiast, or saline rinse, I should say.
We should have asked you to bring one and demonstrate.
Yeah. So basically it's water, either boiled or distilled, plus a salt solution. And it's basically a shower for your nose. So you use it to clean out your nose, and it really helps with what we call mucociliary clearance. So you want to basically help move that mucus along. So it's a great tool. It has minimal side effects. The one thing I do say is that some of the different tools that are out there you just want to be careful how you administer it, because you can get some ear pressure or ear pain if you do it too forcefully.
What is a sinus headache? You hear that mostly in advertising for medications.
That's a great question. So we describe sinus headaches as frontal pain as pain or pressure in your face. There is really no actual true definition of a sinus headache. Headaches can be very multifactorial. And in fact, a lot of patients come in saying that they think they have chronic sinusitis. And we get a CT scan and their sinuses are clear. So even despite having the symptoms of pain and pressure in your face, that may not necessarily be your sinuses. That may be another source of headache.
Viewer email titled Sense of Smell from Chris. The question is, what's the best treatment for chronic anosmia? Anosmia.
Yeah. So I would definitely recommend being evaluated for that. There can be a lot of reasons why people have anosmia.
Which must be something about your sense of smell.
Excuse me, yes. Anosmia is complete loss of sense of smell. And it can be very detrimental to people. It is very closely associated with your sense of taste.
Sure.
And so people, it's a big quality of life factor. There are a lot of reasons why people lose their sense of smell. There can be an upper respiratory tract infection that causes it, so they get a viral loss. There can be, chronic sinus disease, so inflammation of the sinuses. And then there can be other things that are, more concerning, like tumors. So it's definitely important to get that worked up and ruled out. Unfortunately, and depending on what it is that caused the loss of sense of smell will really kind of dictate how to treat it. Unfortunately, there's not much to do in a lot of patients who have loss of sense of smell. We're looking for answers for that in the rhinologic community.
Call from Delaware, Sussex County. This is Cynthia. Cynthia, thank you for calling. Go ahead.
Hi, I have a question. I've had a sinus infection for over a year. Recently, it's become worse. My sinuses or swelling. You could see the swelling through my skin where it's red. I'm having discharge coming through my pores, my eyes, my gums of my teeth, and now it's recently made little pinholes in my lips, and the discharge is coming out of there. It's like white foam. I've been treated with Augmentin. I'm on now, and ketoconazole in the past, and it's still, my glands are swollen, and it's still not good.
Cynthia, before I run out of time, let me get you an answer on the air. Thank you for the call.
I just want to know about the drainage.
Okay, thank you very much. What would you advise?
Yeah, so if she hasn't seen an ear, nose, and throat doctor, I would definitely advise that she see somebody. She needs to have imaging. She needs to have most likely a culture of whatever that drainage is to see what the appropriate antibiotics are. And she may need surgery at that point.
Uncommon to hear a case that severe?
You know, I do see a lot of patients who have chronic sinus disease. It's actually not that uncommon for me, again. But the level of severity where she's saying it's extended externally is quite unusual.
Very good. Dr. Andrea Hebert, University of Maryland Medical Center, top 10 in otorhinolaryngology.
Thank you.
Thank you very much.
Thank
we
you.
appreciate it. We're back Thursday at this time with Your Money and Business, and then Friday for State Circle. For all of us at MPT, thanks for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.